EMS arrives with a 49-year-old male with a history of cirrhosis and hepatitis C. His wife called 911 when he started vomiting bright red blood. On arrival, he's pale, diaphoretic, he has a blood pressure of 92/78, his heart rate's 130, and his respiratory rate is 28. So what do you think of this case? Does he meet ESI level 1 or 2 criteria?
Maybe. He is a little hypotensive.
Okay.
And he's also tachycardic and tachypnic.
So are you thinking ESI level 1 or 2?
Well, I think it can go either way.
Okay, think about his history. What is he at risk for?
Well, he could bleed out from his varices.
Okay, but what immediate life-saving interventions does he need?
He needs a couple of lines for fluid and blood. So I guess he's a 1.
Mm-hmm. Right. He's hypotensive, tachycardic, tachypnic, he's pale, and he's vomiting blood. He needs immediate IV access and possibly O-negative blood and at least a fluid bolus.